Welcome to episode 22 of the Cancer Pod. Today we're talking about folate. What is it? Where does it come from? Why do we need it? What happens if we don't get enough? All this and more on today's episode of the Cancer Pod, Supplements 101.
I'm Dr. Tina Kaiser, and I like roasted Brussels sprouts.
And I'm Dr. Leah Sherman, and I like steamed asparagus.
And we're two naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the host and their guests are solely their own.
Welcome to the Cancer Pod. So Tina.
Yes, Leah?
What's the deal with folate, folic acid, vitamin B9? So many names.
Yeah, I think it's something that's really confusing, especially because there are people out there writing almost scientifically valid blog pieces, but missing the accuracy.
They're interchanging the words around.
Yes. So let's just be really clear. Folic acid does not occur in nature. Folate does. So first things first, when we're talking about B9, all of these are considered B9 variations.
Vitamin B9, yeah. Not to be confused with benign.
Right, not to be confused with benign. Folic acid and folate are used interchangeably a lot, but they're not the same molecule. And so chemically, the compounds are completely different. Folic acid is what is used to fortify foods. So it's added back after you process a food and pull B vitamins out of a food. Folic acid is what's added back. Folate.
And it's also what's used in supplements.
Often it's what's used in supplements, especially if it's a less high quality supplement.
Right. It's probably more common in like certain grades, higher grade supplements, folate is used. But the common over-the-counter shelf stuff, you're mostly going to see folic acid.
Yes. And of course, we, as always, advocate food over supplements anyways.
Right.
And folate, which is found in food, can be gotten from the diet. You can get plenty of folate from the diet. How much someone needs depends on that person, right? A pregnant woman will need more folate than someone who's not going to be carrying a baby, for example. Folic acid is absorbed more readily than folate. And it's more stable. That's why they put it into supplements. That's why they put it into food.
Okay.
Folate degrades more quickly. So you need the plant cell wall to keep it inside the plant cell. And the folate doesn't degrade until the actual food stuff degrades. But as long as it's inside the plant cell wall, it's fairly stable. And once you pull it out of there, like, cooked your food and left it on the counter, it's going to degrade. So folate is very fragile.
So it comes from green leafy vegetables.
Mm-hmm.
So like your asparagus, your broccoli, your kale, anything that's green.
Mm-hmm.
And so using those as fresh as possible, you're guaranteeing to get a decent folate level. So like the wilted chard that's in my fridge that's been there for 2 weeks probably doesn't have the best levels, I'm guessing.
You're right. And this goes back to that thing that we've talked about before, which is when you cook vegetables, if you are cooking them in any way, however you do it, steam it, stir fry it, whatever, the brightness signifies the most bioavailable moment. When we eat a plant, if we can see the broccoli is really bright green, that's when you've broken open those cell walls, the plant cell walls, and you're looking right at the chlorophyll. So it seems brighter than it did when it was raw, for example. And if you keep cooking it, it's going to get more and more gray, really.
So when you see like things of like different levels of folate in food, you'll sometimes see that cooked foods have higher folate content because it's more bioavailable because of steaming or, however you've cooked it until that bright green point.
Yeah, it's kind of one of those things that isn't mentioned very often, right? And that is that whenever we talk about nutrients in plants, they're inside the cell wall, which is made of cellulose. And you and I can't digest cellulose. We have to break it open either by chewing it, cooking it slightly, putting it in a blender, whatever we're going to do. We have to break open that cell wall to get to the goodies inside.
That's our cooking tip for today. Not a big fan of green leafy vegetables? You can find folate in beans, peanuts, whole grains, sunflower seeds, seafood, eggs, even liver.
So, for those who have read about this before, you may have come across the term 5-MTHF, which is methyl tetrahydrofolate, or 5-methyl tetrahydrofolate. That is the most active forms of folate within the cell. The reason I'm mentioning this is there is an enzyme that some people are getting tested for to see if they even create that within their cells. So that's that MTHFR.
The genetic mutation.
Yeah, so the MTHFR is an enzyme, and that stands for methylene tetrahydrofolate reductase. That's a mouthful, which is why we all say MTHFR.
And that's why you say it and not me.
And some people are checking whether they got a little glitch, a little what we call a SNP, SNP. SNP stands for single nucleotide polymorphism. That's it. I'm done. That's all the big words I'll use today, I promise. But anyways, those SNPs, if you got one from mom or one from dad, you may not convert folate into a usable form as efficiently. Then you are going to produce less of this 5-MTHF, which is the very active form that's needed in the chemical reactions in the body. So those people often do better when they take a supplement that contains 5-MTHF.
And you had mentioned when we were offline that actually can degrade quickly too.
Yes, very volatile. So the best supplement companies are putting that, the actual active form, 5-methyl tetrahydrofolate, you'll see on the label 5-MTHF. That's the most usable form, with the caveat that it degrades quickly and it's not as absorbable as some of the other folates out there.
So if you have a bottle of a multivitamin and it has this in it and it's been sitting on your shelf for 5 years, maybe you get rid of it if it's past the expiration date.
It's probably going to degrade quickly, just like a plant would on your counter.
Or if you overcook it.
Right. You can break it down.
So it's probably good to point out that folic acid, which is found in supplements and in fortified foods, it needs to be converted to folate. Mm-hmm. And that conversion happens in the liver, and then it's absorbed in the upper third of the small intestine. Mm-hmm. So that kind of gets cancer patients, cancer survivors thinking in terms of if there's any impairment to those parts of your body, there may be a potential for deficiency. Deficiencies also can happen with people with a history of alcoholism or just the non-alcoholic fatty liver because of the fact that folate is stored in the liver.
And along those lines of who might be deficient is anyone who doesn't have a good, healthy upper small intestine, because both folic acid, folate, however you're taking it in.
Right. So somebody with celiac disease.
Yes, that is a prime example of where the villi, the microvilli of the small intestine are damaged, and it's celiac disease. And this is one of many nutrient deficiencies that can result.
So there are also medications that can interfere with folate metabolism that are used in cancer care. So methotrexate is one, pemetrexed, Alimta is another. Mm-hmm. And so sometimes if you're receiving one of those treatments, you may, be prescribed a supplement from your doctor because these medications are targeting that.
Yeah, can I mention right there, that's an interesting phenomenon, right? So the drugs you just mentioned actually target the folate pathways. That's how they stop the cells from dividing. That's how they're used in cancer care as anti-cancer agents. A rapidly dividing cell needs to make a lot of DNA, right? So as you have a cell dividing over and over, it needs to make a new batch of DNA in the nucleus every time it does it. And what methotrexate and Alimta do is they block that by blocking folate, because folate is required to make DNA. And they give you a form of folic acid alongside to make sure that there is just enough to rescue your normal cells.
Right.
So this reminds me of the fact that every nutrient has what I would call a sweet spot, where you have just enough, not too much, you're not deficient, and you're not mega dosing. There's a sweet spot for every single essential nutrient there is. And in the case of B9 or folate, we should discuss that what's a deficiency and what's too much.
So the recommended amount in micrograms, not milligrams, in micrograms for folate is 400 micrograms, and that's in adults. And those are non-pregnant adults. So if someone is pregnant, then it is 600 micrograms a day. So what I find really interesting is folic acid as a supplement or in fortified foods is absorbed twice as much as the folate that's found in nature.
Mm-hmm.
And another little interesting tidbit is you'll only see folic acid on a nutrition label if it's been added. So if you're looking at whole wheat bread that is not fortified, it's not going to have a folate level on there. But if it's a fortified whole wheat bread, it will.
Oh, so interesting. Yeah. Yeah, that's an interesting thought because I'm thinking about how many things have a label and then, there's no one's really telling us nutrient breakdown unless they know it because they put it back in there.
Yeah. And I even looked at some things that I had in the house and, you'll see like calcium level and some other nutrients. But if it's not fortified with folic acid, you're not going to see it on the label. You're not going to know what's in a nice, boule, a nice artisanal.
Right.
You're not going to know what's in a nice artisanal loaf.
Right. That's something to think about.
Yeah. Things that make you go, Okay. So folate itself has been shown to help with, not only folate and folic acid are used to prevent anemia.
Mm-hmm.
Right. So you're taking the amount to reduce your risk of a certain disease. So that's why pregnant women are recommended to supplement with folate or folic acid because it prevents neural tube defects.
Mm-hmm.
And so it's needed, like you're saying, like for DNA and for cellular development. And so that's really important when someone is pregnant because there's a lot of cell division going on. It's also has been shown to be helpful for cardiovascular support. Not only in a developing fetus to prevent certain congenital heart defects.
Mm-hmm.
Folate has been shown to reduce the risk of certain cancers. And that's sort of a double-edged sword, right? Because folate coming from food, fruits and vegetables, has been shown to reduce the risk of certain cancers.
Mm-hmm.
But then taking too much folic acid, the synthetic version, has been shown to possibly have adverse effects.
There was a study many years ago that came out, and when folic acid began to be fortified in bread, there was a study that showed there was an uptick of colorectal cancer. The question became, does folic acid promote colorectal cancer? Well, it turns out, if you looked at the incidence of colorectal cancer over time, it bumped up and then it came back down. And now, after many experiments with animals and further data, it's pretty clear what's happening. Adequate folate helps normal division of cells. Once there's a polyp or adenoma, when that is given folic acid, usually in a supplement or fortified food, it will grow. It will actually promote the growth of a precancerous adenoma into cancer. And once cancer is present, it can promote the progression of colorectal cancer. But cancer of the colon follows a very clear path from normal cells to polyp to adenoma to colorectal cancer. So if the folic acid is being given or eaten in any form, including folic acid, in a supplement or fortified food, and there's no abnormal cells yet, there's no precancerous lesions, that doesn't look like it's a risk factor. If anything, it's giving repletion of folate in the cells. But what we don't know is who has precancerous adenomas and who doesn't. And so when that was done in a large population and folic acid suddenly was in the bread supply, there was an uptick of colorectal cancer until that subpopulation didn't show up anymore in the data. So it's an interesting scenario of the same molecule, folic acid, having a benefit for risk reduction of colorectal cancer and a detriment once there's precancer or cancer present. And it's pretty clear now that that's what's going on. So I do not recommend folic acid supplements, especially in a higher dose, like over 1 milligram, or that's 1,000 micrograms, to anybody with a tendency towards colorectal cancer or
history of
colorectal cancer, because we don't know if there's recurrence, right, ever, or anyone with actual known colorectal cancer. I prefer they get it all from food.
And I think it's good to point out that, like, if somebody does, is trying to reduce the risk or prevent cancer, taking higher doses of folic acid has not shown any benefit at all. So it's more the low folate status that's been associated with an increased cancer risk. But by supplementing with folic acid, it's not really going to be moving the bar.
Right.
And it may actually be detrimental if you have this history.
Right. Right. And yes,
whether it's family history or personal history.
yeah. And you know that as a general rule, if something is known to reduce the risk of developing a cancer, you cannot extrapolate that and say once you have a known cancer or have a history of a cancer, that it's going to translate to that ever.
No, yeah, that's a perfect thing to point out.
Yeah.
So one thing I do want to mention is not only is folic acid found in foods, like the fortified foods like cereals and breads, but also it's in supplements, and it's not necessarily just in B complex or multivitamins, because it can reduce the risk of things like Alzheimer's. Folic acid can be found in more of those kind of cognitive supplements.
Mm-hmm.
The memory ones, the ones that are promoted as like, this is going to make you remember everything. The other place where I've seen it hidden, and I'm sure there are tons of places, but I've also seen it hidden in energy drinks.
Mm-hmm. Yeah.
And those doses can be the 400 micrograms. So that's another place to really be cautious, because a lot of cancer survivors, a lot of cancer patients are really tired. And if they're pounding these, energy drinks, maybe they're on a medication where, you don't want them to take too much, or you don't want them to take it at all, or, whatever. Like, it's just, it's looking at labels.
Yeah. And it's easy to do, because I think for the most part, people think B vitamins must only do good.
Right. You could pee them out. That's what everyone says. Oh, you can take as much as you want. You're just going to pee out what you don't need. Yeah. So another point that I think we had talked about the other day was that leucovorin, which is often part of the treatment for colorectal cancer, in addition to other cancers, it's part of Folfox, right? It's the 5-FU and leucovorin, and then the oxaliplatin. That is a form of folic acid.
Yeah. Yeah. I mean, the fact that they gave it a name like leucovorin, I mean, it sounds awfully toxic.
Ominous. It sounds ominous, right? Leucovorin. It's not a chemo.
No, it's just a form of a folate compound.
Right. And what it's doing is it's activating the F5FU to kind of convert into the cancer fighting drug that it is. And so when somebody is on Folfox or Fulferinox or 5-FU, I think they're still using that to treat breast cancer, you don't want to take a vitamin that has folic acid in it. Folate is fine. Folate from food is fine during that time, but you don't want to take folic acid, because you might be ramping up that activation, which can create more side effects.
Right. You do want to tightly control your intake of exogenous folic acid, because
exogenous, that's such a good word. I'm like, external, exogenous.
Yeah, it's important. And they usually tell you when you're getting that chemo, but for some reason they didn't tell you, or you missed that piece on the paper or the lesson or chemo class. Yeah, it's
because
important.
you just found out you had cancer.
Yeah. Yeah.
Everything else is crickets in the background.
Hey, I have a quick little story about 5-FU. I had a patient, young woman with colorectal cancer, and she was getting 5-FU. And I loved the fact that she really disliked the name. So she decided that she didn't like the name 5-FU, and she didn't want to sit in a chair and take that. And so she renamed it and only referred to it as FU2.
I've seen these stickers that people put on their infusion bags that they look like old school, like pharmaceutical labels, and they have words like hope and like really like positive things. That was her way of being like, no, FU2.
Exactly.
I get it.
In 1931, British physician Dr. Lucy Wills used Marmite, a yeast extract, to reverse macrocytic anemia of pregnancy. A few years later, the molecule folate was identified as the reason Marmite worked.
So folate deficiency can sometimes be seen on certain labs. So if somebody is getting a workup for cardiovascular disease, elevated levels of homocysteine may be seen. Another lab that may show potential folate deficiency is when you're looking at the red blood cells. It might show larger cells, macrocytic anemia, and it can look similar to a B12 deficiency.
Yes.
And so by taking high levels of folic acid, someone may be masking a B12 deficiency.
Right. So when they have their lab, the way that they could see that their red blood cells are larger than normal is through the parameter called MCV, which is mean corpuscular volume. And that volume is the volume of the red cells. And so generally speaking, when it's, 100 or more, you start to look at that and wonder why. If you're in active treatment, remember that baby red blood cells are chubby. So that's how I explain it to people. Ignore it because you got chubby red blood cells. That's perfectly normal. They're just babies. You're trying to reproduce them.
Right. Your bone marrow is just shooting it out.
Yeah, you're trying to catch up to some deficiency because of the bone marrow suppression of the drug. That's fine. But if you're post-treatment and you still see a high MCV, that has to be figured out. And so what you're talking about is that it could be folate deficiency. It could be B12 deficiency, but it's important to figure out.
Right. So in terms of supplementing, like I often think, and I'm in no way an expert, there are doctors who like their practice focuses on MTHFR mutations. It's such a hot topic, especially among integrative doctors.
Mm-hmm.
But I wonder if somebody has this MTHFR mutation and they're taking supplements that have, that have the active form of folic acid, they have folate in them, and they have a history of cancer.
Mm-hmm.
Like, how does that play out?
I think it gets complicated quickly. One, I think people, if they have identified a SNP in that, and they know they're not going to take the folate in their diet and make it into active 5-methyl tetrahydrofolate, if they know that they have a glitch there, then it becomes more complicated for sure, because you want to get enough for your normal cells, but not so much that you're putting yourself at risk of basically accelerating the growth of cancer that you don't know is present. So I would say you'd eat it from food.
I would really focus on the food more than a supplement.
Yeah.
Yeah. I'm kind of sitting here thinking, like, in my mind, I'd be like, let's up the greens intake. Let's up the food source intake before adding in a supplement. And again, that's because it's not my concentration. I think when I was in school, it wasn't even really discussed. And then while it was being discussed, I was working in cancer care and had a very specific modus operandi. What do you call it? I had a very specific style of practicing. And so It wasn't something where occasionally we'd get patients in and they're like, oh, I have this MTHFR mutation and my integrative doctor has me on these supplements. And for the most part, as long as they weren't getting a medication where it would potentially be an, interaction, I'd make sure that it wasn't like some exorbitant amount and then allow them to continue it.
Yeah. I think that in those people, I would say to be very strict in avoiding folic acid as an additive or folic acid in any supplements, or, like you mentioned, there's other ways that it sneaks into complex formulas, to make sure that that's not going in, because there's no reason for that. And then to get as much from diet as possible.
I feel like we kind of covered everything that we were going to talk about.
We did. There's so much more detail that we could talk about with folate and these pathways, and how the foods that have folate also have the vitamin B3 that you need to process the folate.
To absorb it, right? Yeah.
So there's a lot more we could talk about, but let's keep it short and sweet and go into more detail either at another time or on our website.
Yeah. And, I don't want people to think that anytime we list medications where there are potential interactions or, I don't want them to think that that's a complete list. We're just kind of mentioning things, there are NSAIDs and other things that might potentially interfere with folate as well. So it's more like you've said before, Tina, like check with your pharmacist. And then on the basics episode in the show notes, there are some sources to see if there are interactions. Again, those aren't complete lists either. And it's constantly changing as more information comes out because it's science.
Yeah. And can I just say that if you really want the short story, folate, folic acid, all of this stuff, and the things that we mentioned today really lend themselves to pictures. So even if you go to Google and you start looking around, go to Google Images and you'll see what we're talking about a little bit. I mean, I think that it's very visual to picture how folic acid or folate is absorbed, converted, transported in the body, used. I mean, it's very visual.
We're putting that in our show notes. We've got some links. So
perfect.
Find it on our website or wherever you listen to this podcast. And that's what this kind of brings us to. It's going to bring us to our song for this episode.
Mm-hmm.
And you mentioned the role of folate in DNA, the importance of folate. And so our song is called DNA, and it's by a band called BTS. And they are a boy band. And I played the video for you the other day. And how fun is that song?
It's awesome.
I know, it gets you dancing. It's a really fun song. I'm not of the age of BTS fans, I don't think, but I could totally see why they are the phenomenon that they are.
Yeah, no offense, but either one of us would definitely stand out at the concert. I don't think that
People would be like, "Oh, where's your kid?"
right. Why did you bring your mother?
Yeah, why did these people bring their mother? But I get it now. Like I've heard their name all over and I totally get it. So that is our song. That will be in our show notes as well as on our Pinterest page. You can find us on social media, on the Facebook and on the Instagram and on the Twitter. And when you listen to an episode, if you like it, leave a review. If you don't like it, leave a nice review. Let us know if there's something you might want to hear otherwise. Subscribe, follow us.
And share.
And share.
Yeah, mostly. I mean, this might be of interest to you or marginally interesting to you, but you might have a friend or a relative who's more interested, or you want to validate what we're saying with some expert you personally know. Go ahead and send it to them. I'm all for it. Good old grassroots grapevine stuff.
That's right. So on that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time.
5FU wasn't something she really wanted to sit down and, receive into her arm on the chair.
Are you talking about FU part?
Well, yeah, she renamed it. So she called it.
Sorry. Did I just take your punchline?
Yeah, you heckler.
Okay, let's go back.